While it seems the COVID-19 pandemic has stuck around for an eternity and a half, we're still being surprised with new side effects from getting infected. Even now, we're still coming to terms with how the virus can affect us in the long term, and studies in this area have been incessant. One side effect that may come as a worry for males around the world is the dreaded COVID dick, where the penis can become dysfunctional or even shrink as a result of a COVID-19 infection. In the U.S., a man speaking as a guest on the sexual health podcast How to Do It said that his penis had become considerably shorter after recovering from his COVID-19 infection. We're still finding out about new side effects stemming from COVID-19 infections. Image. Oi. The 30-year-old heterosexual man said, "When I got out of the hospital, I had some erectile dysfunction issues. Those gradually got better with some medical attention, but I seemed to be left with a lasting problem. My penis had shrunk," he said. "Before I got sick, I was above average, not huge, but definitely bigger than normal. Now I've lost about 1.5 inches and have become decidedly less than average." Even if it seems pretty crazy, such a depressing side effect is actually quite possible, according to medical experts. In the case of the man, the doctors think it may have to do with vascular, vein, damage in the erectile tissue of his penis. "My doctors seem to think it's permanent," he said. "It shouldn't really matter, but it has had a profound impact on my self-confidence and my abilities in." We've seen this before. Issues affecting penile health as a result of COVID-19 infections were actually brought up and studied in 2021, with a number of male patients actually displaying blood vessel damage in their members. A study conducted by a team from the University of Miami Miller School of Medicine looked at 2 male patients who had shown impotency after getting infected. WITH-COVID-19. Image. Examiner Live. The study, which was published in the World Journal of Men's Health, stated that after inspection with an electron microscope, coronavirus particles were discovered in their penile tissue. It was also stated that both patients showed signs of blood vessel damage in their penises, compared with other patients who had erectile dysfunction, but had never contracted the disease. "We found that the virus affects the blood vessels that supply the penis, causing erectile dysfunction," said Dr. Ranjith Ramasamy, the university's director of the Reproductive Urology Program, and senior researcher for the study. "The blood vessels themselves malfunction and are not able to provide enough blood to enter the penis for an erection," he added. "We don't think this is a temporary effect, we think this could be permanent." These findings have also been backed up somewhat by another study done by researchers at University College London, who found that 5% of men who had been infected with COVID-19 had suffered a step down in penis size, with about 15% complaining of sexual dysfunction. Thankfully though, such side effects may not have to last forever. Dr. Charles Welliver, a urologist at Albany Medical College who was also on the podcast, said that those experiencing such problems could look to rehabilitative methods for a cure, including devices such as penis pumps or stretchers. The original step for temporary loss was to try and use low-dose daily Viagra or something along those lines, he said. But more recently, we started looking at different kinds of stretching or traction devices. Read more life stories. Wearing a face mask makes you more attractive, study finds. Rubbing wasabi on your head can prevent balding, study claims. Jaw-dropping satellite imagery captures the explosive volcano eruption near Tonga. Cover image sourced from JComp on FreePic and House Beautiful.